Good morning, everyone. Good morning from cloudy Brooklyn. It's a little cloudy today. We are so excited to have a good group here already. There's 44 people, and we'd like to welcome you to the next FYI series, Pratt Health Services and Specialists. I'm really excited to have Alexi with us here, our expert on the topic from the Health Service Center. And she will be our main presenter today. Like everyone to feel free to ask questions in the chat that will be answered at the end. So my name is Mia Schleifer. I'm one of the associate directors in the Office of International Affairs, and I'll let Alexi introduce herself.
Hi, everyone who's already here. Thank you for joining. My name is Alexi. I am the nurse practitioner over at Pratt Health Services. And you will probably see me when you come to the health clinic, whether that's for a sick visit or a well visit or maybe a vaccine. And we'll get started in a couple minutes. We just want to give some time for everyone to come on and hop on here. So we'll give a few more minutes and then we'll go and dive into what we're going to talk about today.
I'm so happy someone requested to enable the live caption. So I can see, can everybody see that? Alexi, can you see that?
I can't see the transcript, but I can see that it was enabled.
Gotcha. Yeah. So I'm so happy someone asked for that. That's a really good thing to have enabled for anyone who needs it.
Yeah, I wasn't even aware that that was possible on Zoom. So thank you for teaching me that, whoever that was.
We have 10 more people in the waiting room we're letting in, Alexi, and I think when they're in, we might be ready to rock and roll.
Sounds great.
I think we're ready.
All right. Hi, everyone. My name is Alexi. I am the nurse practitioner, once again, over at Health Services, and we are located in 215 Willoughby. Today, we're going to be talking about Pratt Health Services and other specialists, so other types of doctors that you might need to see during your time at Pratt. This is a continuation of a series with Health Services and the Office of International Affairs. The first presentation we did was about a month ago, and that was about health insurance. We had a lot of amazing questions from that, and we created a Google Doc with a clickable table of contents. So we'll share that at the end with you all in case you have any health insurance specific questions. Today's going to be more a focus on going to the doctor and what you need to have prepared in the United States. So we'll begin. So what is FYI? So FYI stands for First Year International, and it's a series of pre-orientation workshops that are designed by OIA, MIA OIA, to assist new international students. So the first thing that I want to talk about with you all today is the health forms that you need to register for classes. There's 3 different forms that need to be submitted. The first one is an immunization form, so that has your immunization records. The required immunizations are MMR. So MMR stands for measles, mumps, and rubella. And you typically need 2 doses after you turn 1 year old. And oftentimes students will submit titers to show proof of immunity. So that's the required vaccine. And we also require that you fill out the meningitis waiver on that form, or that you fill out the portion on that form that says you have the meningitis vaccine. Most of you have probably already submitted these forms, but if you have any questions, feel free to ask them in the chat box. And also you can always call Pratt Health Services, and I'll share our contact information in a few slides. second form that you need to submit is a tuberculosis testing form. So either tuberculosis testing with a PPD or skin test, or a blood test. So sometimes you might see quantiferin or a T-spot. That's a tuberculosis blood test. Third type of form you need to submit is the physical exam form from your physician in your home country. So that's recommended to do before you come to the US, is to get that physical or annual well exam before you come to the States, just so you have everything in order and all prepared. And plus, it's really important for us to have this information over at Pratt Health Services so that we can help you when you come in, so that we know your health history from your physical exam, so that we know your tuberculosis status, and that you're all up to date on your immunizations. And because, you can't register for classes until you submit these forms, it's important for you to do so as soon as possible. There's a link right here where you can find these forms, and don't worry about writing this link down right now because we're going to share this presentation with you at the end. But that's where you can find all the forms, and it'll explain how to submit them. Prior to submitting these forms, there is a health hold on your record, which prevents you from registering for classes. So if you're having any issues with any of that, you can always contact us at Pratt Health Services, email or phone, and I will share our contact information further on in the presentation. So in the United States, there's many different places to get medical care. The first place that we recommend that you reach out to if you have any health concerns or if you need any type of medical care is giving us a call or emailing us at Pratt Health Services. We do well visits, we do sick visits, and more. I'll go into a little bit more detail later about the specific types of things that we offer at Pratt Health Services. The second type of place that you will go to get medical care would be an urgent care clinic. So this is maybe for sick visits or minor injuries for when Pratt Health Services, when my clinic here is not open. So we're here Monday through Friday, 9 to 5. But we're not here on the weekends. So if you have an injury on the weekend, or say you have a sore throat, or if it's after 5 p.m. on the weekday, we recommend that you head over to an urgent care. Thirdly, specialists. These are doctors that are trained in a particular type of medicine. So they're specialized in a particular type of medicine or a particular area of the body. For example, a heart doctor, also known as a cardiologist, a dermatologist, also known as a skin doctor. Sometimes if you have a chronic health condition, maybe you have hypothyroidism, you might need to see a specialist for ongoing care. Most of the time, if you have a chronic health condition, you know that you need to see them when you arrive in this country. But if you have any concerns or questions and you're not sure if you need to see a specialist or if you just need to come to us, we can definitely help you. And we also help with referrals to finding specialists and setting you up with appointments if need be. And fourthly, this is kind of the last resort, I would say, is the hospital or emergency room. So in the United States, the hospital or emergency room is really just for emergencies or serious health issues only. It can be really expensive, the medical bills for the hospital, the emergency room in the United States, and wait times can be extremely long. Like I'm talking more than 5 hours if you're going in there for a sore throat or something that isn't life-threatening, because they need to prioritize the care for people that need it first. So for people who are going in after a car accident or after a head injury, they're going to be seen before you. So really the hospital emergency room is really the last resort. It's only for emergencies or serious health issues. I don't recommend going there, for example, for STD testing or for a cold or a respiratory infection where you're not having difficulty breathing or a minor injury. All of that you can come to us or urgent care. So it's best to just check with us first before you think about going to the emergency room if you think you need to go. We might be able to help you, or we can send you to a specialist if need be. This is often a much cheaper option and often more helpful in getting you treated for your medical problem, and you won't be waiting as long. So it's really important to be ready for your doctor's visits. At Pratt Health Services here, we don't require health insurance, so we can see you for free. This, doesn't include if we order blood work for you, or if we send a prescription for you to the pharmacy, that you will need health insurance for either blood work or a prescription. But seeing you in the clinic and doing, say, a well visit or a sick visit, we don't require health insurance. But if you're going to an urgent care or if you're going to see a specialist, it's really important that you take your health insurance card and a picture ID with you. I always tell students that you can save a picture of your insurance card in your email or your phone for convenience. So I know that a lot of health insurances now, like the Aetna student health insurance, doesn't give you a hard copy. They have it, you can log in online and get it. So just screenshot it and save it to your email so that you always have it. Secondly, it's really important that you bring all of your prescription medications or maybe just a record of the medications that you take. Even if they're, the brand from your country, we can usually figure out the equivalent medication here that would equate to that. So it's really important that I or the specialist or the urgent care doctor knows all the medications that you're taking in case we have to prescribe something and we want to make sure it doesn't interact with any medications that you're on. It's also really important to know your family's history, family medical history, and your personal medical history. So any past or present illnesses or chronic conditions. So maybe if you have asthma or anemia, things like that are important to tell us, or if you have a thyroid problem, if you've ever had any surgeries or been hospitalized. And, we will ask you all this, but it's important for you to know your health history and know your family's health history. If, say, somebody in your family has diabetes or a heart problem. It's also a good idea, very wise, to bring a list of questions and notes to discuss. Sometimes even, when I go to the doctor, beforehand, I'm like, okay, I have to remember to bring up this, this, and this. And then I show up and I forgot to bring up 2 things that were really important. So maybe just make notes beforehand that you need to talk about, whatever you need to talk about so that you don't forget. Taking notes during your visit is sometimes helpful too. I often print out a lot of information for students so that they can bring it with them. I know sometimes going to the doctor, you get hit with a lot of information at once. Taking notes during your visit, whether that's with me at urgent care or when you're seeing a specialist. Sometimes if you need to bring somebody along, especially with translation, that can be helpful. I know that's not always possible, but sometimes if you need to, that can be helpful. And lastly, be prepared to pay your copay if there is one. So copay is a set amount that you pay for a doctor's visit or a prescription or blood work, and that's through your health insurance. We go more into copays and what that means from our first webinar. So again, I will share that information with you at the end of the chat. But basically, there's no copay to see me at health services, but you might have a copay that may be $10 or $20 if you go to urgent care. And that basically means that your health insurance is paying for most of that visit at the urgent care, and you owe the rest of the cost, which may be $20, for example. So we're going to talk about Pratt Health Services first. So this is the first stop for any medical concerns or issues that you have. Always, come to us or ask us questions if you're not sure where to go. So we do sick visits. If you have a fever, cold or flu symptoms, respiratory infection, sore throats, bladder and urinary tract infections. We also treat cuts, scrapes, and minor injuries. We also do well visits, so annual physicals, sports physicals. If you're going to be playing a sport at Pratt, I know things are opening up this year. and people are able to participate in things again, which is great. You might need to see us for a sports physical. We also do PAPs and annual gynecological visits, so that's women's health. We also treat and test for sexually transmitted infections. And we also do HIV prevention. So there's two medications known as PrEP and PEP, which you may have heard of, that are used to either prevent HIV, or if you are concerned about exposure, you would take PEP. So we do a lot here, and we also just do general health, wellness, education. So it's good to always come to us or call us or email us to see if we can help you first before going to urgent care or seeing a specialist. Oftentimes we can treat you, and it's much more convenient. Other services we offer, so referrals to healthcare specialists. So I am a primary care provider, which means that another word for it would be, I guess, general practitioner. So I can treat a number of issues, but sometimes things might be a little specific to a certain body part or a certain issue. So you might need to see a heart doctor, and I can refer you to a heart doctor. You might need mental health therapy, and I can refer you to a therapist. We do immunizations, so tetanus boosters. If you cut yourself with metal, you'll need a tetanus booster. The tetanus shot is given every 10 years. Flu shots we do every year. We usually do a big mass flu clinic kind of vaccination event. So those are a couple that we offer. There's a few more, but just call ahead to confirm that we carry the vaccine you need. Unfortunately, we get a lot of questions about the HPV vaccine, human papillomavirus, which protects against certain types of cervical cancer. We do not offer that one, so don't assume that we have the vaccine that you need. Give us a call first, and if we don't have it, we'll let you know exactly where you can get it in the area in New York City. We also offer hormonal and non-hormonal birth control options. One-on-one help with improving sleep. That's my specialty. So if you're having sleep issues, insomnia, we have a pretty robust program with regards to that. And lastly, we can help you manage your health records. This is our contact information. That's our website information. You can call us. We're located at 215 Willoughby Ave. That's where I am right now, on the first floor. And you can also email us at health@pratt.edu. You can screenshot this right now if you'd like, but again, we're going to share this presentation with you at the end, so don't feel like you have to write everything down super quickly, but this will all be here for you. All right, so currently we offer mostly virtual visits. I am in the clinic on Wednesdays over the summer. In the fall, we'll be here Monday through Friday. And at that point, you can choose whether you want to come in or if you want to do a virtual visit still. And you can request a virtual appointment by either calling 718-399-4542. That's the clinic's number, or again, emailing us at health@pratt.edu. So if you are overseas and you need assistance, or you're not at the clinic, or maybe you're a Manhattan student, or it's just easier for you to do a virtual appointment, and if it's something that we can treat virtually, we will definitely do that. We also offer in-person appointments. Like I said, I'm here on Wednesdays over the summer. In the fall, I'll be here every day. So basically what is important to do for setting up these in-person appointments is setting up your health portal at pratt.medicatconnect.com. And on here, you can actually make appointments online for in-person appointments. Right now, unfortunately, we don't utilize this health portal. It's probably going to be available again in the fall. So you can't use the health portal right now to schedule appointments, but you likely will be in the fall. And I say here, we'll resume the self-service portal appointments once it's possible to do so. So that'll be a nice convenience and ease for you once we set that up again. So for in-person appointments, it's important that you meet all the Pratt mandated requirements for entry on campus. And I can't stress this enough, but with the pandemic, with COVID, things change really quickly. So, one day we say, you need X, Y, and Z, and then the next day you no longer need that. So make sure that you're checking your emails and, calling us to see what you need to get on campus. If you're going to be on campus and you already have access on campus for classes, then you have access to see us. But you need to have your social contract signed, and you need that to enter campus in the fall anyways. You also need to upload your COVID vaccine record, which you also need if you're coming on campus for classes in the fall, or if you're not vaccinated, you're going to be participating in weekly COVID testing. We go into a little bit more detail about that in the previous webinar. But there's also information on it online. If anybody has any questions about that, I can guide them to that webpage. And thirdly, you can find more information. I actually put the link right here. You can find more information on returning to campus at pratt.edu/coronavirus/campus access. So make sure that you meet all these requirements for getting on campus. Otherwise, we won't be able to see you in person. And in that case, if we can't see you in person, we'll do our best to assist you over the phone for a virtual appointment. All right. So for walk-in appointments, right now, walk-in appointments, so these are appointments that are made without making an appointment ahead of time. These are made at the discretion of the healthcare provider, so me. We can't guarantee that we have availability at the time you walk in. So if you come in, say for a sore throat, I keep using the sore throat example, but it's pretty common and easy. So say you come in and you have a sore throat and you want to be seen right away. You might have class later and you can't come in. We'll try our best to see you, but if we have other patients that have, appointments during that time, we might not be able to, but, we'll do our best to accommodate your schedule and get you in as soon as we can. It's right now, it's just best to schedule an appointment if you're able to do so. So we won't necessarily turn you away, but better to schedule an appointment. What if I am a Pratt Manhattan campus student? So this is a question we get a lot. At the Pratt Manhattan campus, we don't have a health services clinic like we do here at the Brooklyn campus, but I still see Pratt Manhattan students all the time, either virtually or before the pandemic, they were coming in to see me. So as long as you have access to campus, meaning you've submitted that record, the COVID vaccine record, your social contract, or if you're not fully vaccinated yet, you're getting a negative COVID test per our COVID testing policy, which can be found on this link, then we can see you. So you have access to this, whether you're a Pratt Manhattan student or you're a Pratt Brooklyn student. So spread the word to any of your friends if they're Pratt Manhattan students. We can see them. When would I need to see a specialist? So I want to go over this topic again. So this is like really kind of the second or the third place you would go to get medical care. First, you would come to us. And if we can't treat you for it, maybe it's just kind of above our knowledge of expertise for a particular area of medicine, like dermatology here, skin doctor, or cardiology, or if you have a chronic health condition, you might need to see a specialist. But if you're unsure, please ask us, and we'll guide you to the resources that you need to set up an appointment and make sure if you need a referral letter for that specialist, we give you a referral letter. On campus, we don't have any specialists. I do primary care and I do women's health and I do STD testing and sexual health and a little bit of mental health. So I'm kind of a jack of all trades. But if it's something really specialized, you're going to need to see a specialist off campus. And there's plenty in the area, and we have referral lists and can definitely guide you in the right direction. How to find a specialist. So like I said, we can help you find an in-network specialist at Pratt Health Services. So I kind of wrote that weirdly, but it doesn't mean the specialist won't be here at Pratt Health Services, but we at Pratt Health Services will help you find a specialist in Brooklyn or Manhattan or Queens or wherever you're living. And we make sure that that specialist is in network. In network means that your health insurance will cover all or a portion of that bill from the specialist. If you see an out-of-network specialist, you're going to be paying a lot of money. So again, call or email us, and we will help you get set up with an in-network specialist that's covered by your insurance. Okay, so urgent care. So this is another place that you might need to go to, especially if it's after hours. So if it's after 5 p.m. during the week, or if it's Saturday or Sunday when Pratt Health Services here is not open. Urgent care is a type of doctor's clinic for non-emergency care. So they provide walk-in appointments. Typically, people go to an urgent care for sick visits. Maybe they think they have a sexually transmitted infection. Maybe they think they have COVID. Maybe they think they're concerned about an injury from the studio. Maybe they might need stitches. So these are non-emergency appointments. They do have a lot of urgent cares have x-rays. So if you're like, I'm not sure if I sprained my ankle or if I broke something, they can do x-rays a lot of times to make sure that it's not broken, and that saves you a trip to the emergency room. It saves you hours upon hours of hours that you would normally be waiting in the emergency room. They do often have extended hours. I don't know specifically each urgent care how late they're open, but typically around 10, maybe 11 at night, and they open around 8 or 9 in the morning. So if it's something that happens around like 7 or 8, usually an urgent care will be open. Urgent cares are located all over the city. So the closest one to Pratt, the Brooklyn campus, is MedRight. It's right around the corner from Pratt Health Services, where I am right now. It's MedRight at 504 Myrtle Avenue, near Willoughby Hall. And they see a lot of Pratt students. So they're very familiar with Pratt, and they're very helpful, and we really trust their care. So you'll be in good hands if you need to go there. There's plenty of other urgent cares that are all over New York City. So if you're a Pratt Manhattan student, there's probably a City MD or a Modern MD nearby. City MD and Modern MD are chain urgent cares. So that means that they have multiple locations. And they also provide the same type of care that MedRight does. So when would I go to the urgent care? So I kind of touched on this a little bit, but maybe you accidentally cut your hand with an X-Acto knife. We've seen that a lot. Unfortunately, that's a common injury at Pratt. We don't do stitches at Pratt Health Services. So if you need stitches, you would go to urgent care. If you're not sure if you need stitches, you can come and see us. And if we think you need stitches, or if we say, yes, you need stitches, we'll send you right over. So they do stitches. They also do Dermabond, which is a special glue. So instead of stitches, they'll kind of glue a laceration. For sprains, they have x-rays to rule out fractures. For sick visits, UTIs, that's urinary tract infections, sexually transmitted infection testing and treatment, respiratory infections like coughs, colds, flu. They also have flu shots at many places. If you have minor aches and pains, maybe you have some back pain. We see all of this at Pratt Health Services, but if we're closed, then you would go to an urgent care. And if you needed a chest x-ray, you would go to an urgent care. Most people don't know why or when they would need a chest x-ray. That's usually something that a provider like me would say, you need a chest x-ray, you need to go to urgent care. We don't have it at Pratt Health Services, so if you needed that, I would send you to MedRight or the nearest urgent care. Some urgent cares also offer, actually most of them at this point offer COVID testing and the COVID vaccines. It's really easy to get a COVID vaccine these days. They're all over the place. So if you need a COVID vaccine when you get to campus, or not when you get to campus, sorry, you won't be allowed on campus yet. When you get to the US or New York, we can help you find a COVID vaccine site. So that's really helpful and convenient. Lastly, when would I go to the hospital or the emergency room? So in the United States, the hospital is really only reserved for serious medical issues. So the ER, which is in the hospital, is really for serious or life-threatening emergencies only. I gave some examples here. So if you have a head or an eye injury, I'm not talking about an eye infection, but an eye injury where your eye is really, you're having a lot of eye pain or you're having trouble seeing, seizures or severe pain. If you've gotten into a serious car accident, if you have broken bones, chest pain, difficulty breathing, heart attack or stroke, concussion or confusion, after fainting, if you've had a severe allergic reaction, so this is known as anaphylaxis. If sometimes with allergic reactions, they become so serious to the point where your throat swells up and your throat closes and you have a hard time breathing, or your whole face swells up, you would probably need something called an EpiPen. And if you're given an EpiPen, even if it's at Pratt Health Services, you have to go to the hospital after because they have to monitor you. It's a very strong medication. It can be life-saving, but there needs to be monitoring after. Lastly, I mean, there's many other reasons, but serious burns. So if you're very seriously burned, then you go to the hospital, and probably like a large portion of your body was burned, or the burn, maybe it was on your hand or your arm, is really intense. We do treat burns here, but they're kind of usually like first degree, less serious. And again, if you're unsure, just ask us. We'll see you in the clinic. And if we say this is something that needs to be in the hospital, we will, call an ambulance and get you over there right away. But I really want to reiterate and stress the fact that the hospital is only for emergencies in the US, because I don't want any of you having to pay these crazy bills at the hospital or the ER for something that we could help you out with in the clinic for free, or going to a specialist or urgent care for, which is much cheaper. I want to talk a little bit about some resources in case you have any on campus or any emergencies. So if it's after hours, meaning you can't call Pratt Health Services, or maybe you're far away from Pratt Health Services, we suggest calling Pratt Campus Security. That's their number, 718-636-3540. So you can call that from your cell phone, or they have extension 3333 from an on-campus landline phone. I'm not sure if students use on-campus landline phones anymore or where they're available. So probably the first number, the 718-636-3540, is going to be your number in case you have any emergencies. And that, is if anything at all happens that it is, life-threatening, or you're concerned about your safety or somebody else's safety. If there's an off-campus emergency, so if you're walking on the street and something happens, or you're at a restaurant, or you're at the park, or you're somewhere off campus, right? You're going to call 911. And when you call 911, somebody will pick up and they will ask you what type of emergency it is and what's going on, and they'll guide you to the next steps. And I really want to emphasize that health services here at Pratt, we can't provide the level of care that an emergency department does. So if you have a broken bone, or something very serious, we can't treat very serious injuries or emergencies. So always use your best judgment when deciding where to seek treatment. And especially if it's time sensitive and every second counts and you're not sure, it's better to call 911. If it's, you have some time, you can always call us and we can help you. But if it's something really serious, best to get to that ER right away. And hopefully that doesn't happen. It shouldn't happen, but I just want to put it here in case. These are some emergency hotline numbers. We also have them on the Pratt website, but there is a suicide hotline, a couple actually. So, you know, if you are feeling extremely depressed and you need somebody to talk to, or if you know of somebody that feels that way, you can call those numbers. First numbers in English, second Spanish, third they speak in Cantonese, Mandarin, and Korean. Then there's also a crime victim number there that you can call if you are a victim of a crime. You can also call 911 instead. If you're a victim of rape or sexual assault, you would call 212-227-3000. You can also call us if that happens and we'll guide you. Currently, we're training to be sexual assault nurse examiners, so we can help you with that. And lastly, if you're a victim of domestic violence, that's the number there. So these are obviously, I hope nobody ever needs to call these numbers, but they're here if you or a friend or an acquaintance needs them. These are psychiatric emergency rooms. So if you have a psychiatric emergency, and I'm not just talking about feeling, you know, a little anxious or maybe feeling a little down over the last few weeks, but serious psychiatric emergencies. Maybe we, you know, would suggest if you called us and we were concerned, we might suggest you go to one of these. But again, this is, you know, really serious stuff. So rarely, if ever, happens. But these are some of the psychiatric emergency rooms in New York City. So there's the New York Presbyterian Hospital, Long Island College Hospital, which is actually in Brooklyn, not Long Island, the Rape Crisis Team, and Long Island College Hospital number, Pratt Institute Security you can also call if you or somebody else you know is having a psychiatric emergency. So again, that extension 3333, which probably you're not going to use, you're going to call the 718-636-3540 from your cell phone. And if you're ever in doubt, such as where you need to go for a health concern, I know I've said it 10 times already, but I'll probably say it 10 more before the presentation ends. I know that the healthcare system in the US is really confusing. Even as somebody who works in it, as a patient myself, it's confusing. So we can guide you to the appropriate steps. We're here to help. We want to make sure that you're not spending unnecessary money on testing or treatment. We want to make sure that you're getting the care that you need, the quality care that you need right away, and that you don't feel alone or helpless. So we are really, really here to help. Again, that's our number, 718-399-4542. And that's our email, health@pratt.edu. And that's our location, 215 Willoughby Ave on the first floor, suite 117. And that's the last slide. So I think, Mia, we can open up for questions.
Sure, definitely. First of all, I'd like to thank you so much, Alexi. That was a very clear presentation to help students understand the difference between what's available at the health service office here at Pratt Institute and urgent care and hospital and specialists. It just breaks my heart sometimes when students go to the emergency room for things that are not emergencies and then get a huge bill. I just heard a story yesterday about someone who needed one stitch, wasn't a Pratt student, but it was an international person, needed one stitch, hit her head and went to the emergency room and it cost $8,000.
Oh, that's terrible. I hate to hear that too.
And thank you so much for, helping at least students understand the difference and how to get help when emergencies happen. Yeah, thank you. Did a great job. So there are many questions that I will ask just to keep organized. I'd like everyone to stay muted. Just post your questions into the chat if you still have one. We have 20 minutes, so there should be plenty of time to get them all answered. And I'm going to try to bunch the similar questions together so we don't repeat the questions. The first one, people have noticed that the portal to request to waive the insurance or enroll insurance is not activated yet for the fall 21. It's still the old deadlines of last fall. Do you happen to know when they're going to update it for the fall 21, or is that more like the Student Financial Services organized that form?
Can you repeat that? I want to write it down because I'm not
Sure.
totally sure and I might need to ask my supervisor.
Yeah, there's a link that I found on the health website to, it says to waive or enroll in the health insurance, use this link. And when you open it, I tried it myself. When you open it, it says that the deadline has passed. It was last September 2020. So I've recommended to students to wait to fill it out until it's reactivated. And I wasn't sure if it's your office that enables that form and updates it, or is it the Student Financial Services? Because on the website, it says for questions, contact Student Financial Services.
I would assume they would contact Student Financial Services, but I don't mean to pass the buck in saying that. So I'm going to reach out to my supervisor, Debbie, and find out. Why don't we add that question to, or keep that for now, and then later on today, for any questions that I didn't or couldn't answer, we'll send out a document that has all the questions and the answers, and that'll be one on there. I'm not totally sure why it shouldn't be from last year. I think it should be updated at this point. So I'm not totally sure. I didn't even know that. Thank you for bringing that to my attention.
Yeah, well, students brought up a good point about the deadline for tuition being August 1st, and that's 2 weeks. So you know what to do about the tuition bill and so on. So unfortunately, right now, as you can all see, between Lexi and I, we don't have the answer to that question. So
Yeah.
I would say if you're ready to pay your bill right now and you're going to waive your health insurance, what you want to do is reach out to the Student Financial Services, SFS. Let me paste it in the chat. SFS@pratt.edu. You to ask them that question. And I understand some students are saying that they did email them certain questions and they never got their question answered. Just keep in mind, all offices, including ours, are very busy helping the new students. So just be patient. And keep refreshing that link to see if maybe it gets updated in the next couple of days.
I'll try to find out the answer to that as soon as possible, and we'll send out the answer later today in a Google Doc with any other questions that we might not know.
Yeah, thank you. People are asking questions about the test required to enter campus, the RT-PCR COVID test. And versus getting fully vaccinated. One student asked, do you still need the test if you're vaccinated? No. And also, where can you get the test? One student's arriving one day before they need to be on campus.
Great question. If you are fully vaccinated, so fully vaccinated means 2 weeks after your last dose of whatever vaccine, you do not need to get COVID tested anymore or at all to come on campus. So as long as it's been 2 weeks past your second dose, if you only had one dose, then 2 weeks after that dose, depending on what vaccine you got, you don't need a COVID test to get on campus. You don't need a PCR test. If you aren't going to be fully vaccinated by the time you come to the US and you're going to have to come on campus, you will need to get COVID testing done within 72 hours of coming to campus, and then you're going to need to do weekly testing until you're considered fully vaccinated. We actually set up, or we will have set up, the weekly COVID testing. So if that's something you need or will need, you send us an email or give us a call and we can give you a bit more information. If you need a PCR test like the day before, usually MedRight has a PCR test, but I'm not sure if it comes back same day. A lot of places have PCR tests, but they take like 2 to 3 days to return. There is a test called real-time PCR. That's the one that you were talking about, RT-PCR. Offhand, I don't know many places that have that. I can, because it changes so much with the testing that's available in the area, I can do a little bit of research and let you know what's available now. However, it might change. I can't guarantee that what I send out to you today will be available in August. it might change, but it's best to kind of give yourself a couple days, maybe a week before you get on campus when you get here, so that you have time to get tested and get results back. But we do need a test within 72 hours. So, get here, and then, within 3 days of coming to campus, I would say, 3 days before, get your test. So you have a few days for it to come back so that we can get the results in time.
Thank you. The next question has to do with uploading the forms. There are several students who said they uploaded all of the forms. I guess there's 3, they're telling me. But when they get the email confirmation, it says that only their immunization forms were approved.
Right now, we don't have, and that's something we're actually working on with IT. So I apologize if that was confusing or stressful or frustrating to anyone. Right now, the only email confirmation that you get is for the immunizations, and that's because that's the one that's most important. It doesn't mean that we didn't get your TB or your physical exam. We're working with IT to make basically to send you an email for those ones as well, an automated email, but you probably won't for the TB at this time.
Great. So in other words, they shouldn't really worry about it as long as they uploaded it. It sounds like in the future, they'll be getting confirmation about it.
Definitely. Immunizations is really important. So you should get an email. If you don't get that email for the immunizations, contact us. That's the big one. That's really important.
Yeah, it's state law, right? State law.
Yep, New York state law.
Thank you. There was, what was I going to ask? Oh, there was about the MMR. There's a student asking if they can get their first dose in their country and the second dose after they arrive of MMR.
That's fine. The minimum interval between the first and second dose is 28 days. So as long as it's been at least 28 days, you can get the second dose. Doesn't matter if it's both here or both in your country, or one in your country and one here. That's okay. That's totally acceptable.
Great, thank you.
Oh, I just want to say, that being said, contact us so that you can register for classes, because if you don't have both of those MMRs completed, we won't be able to let you register for classes. Okay, how can I say this? We will let you register for classes temporarily, so we'll kind of lift a hold on your records so that you can register, keeping in mind that you need to have that second dose after a certain date. So if you're kind of one of those exceptions to the rule where you have your first dose, but it's too early to get your second dose, contact us at health@pratt.edu or give us a call on this number, so that we can kind of keep you in mind, so that we're like, okay, that person is okay to register for classes. They can't get their second dose yet, and they will get it at this date.
Thank you.
Some questions.
Thanks for explaining that. Here's another question. It's a little bit of a change of topic. Can eyesight corrected people get annual eye checkups at Pratt Health Center?
That's a good question. Eyesight corrected, meaning glasses, or they have glasses or contacts, I'm assuming. We don't have an optometrist or ophthalmologist on campus. We have one of those Snellen charts. So Snellen chart is kind of when you stand at the other side of the room and you're reading the lines and of letters, and then it'll tell you what your vision is. If you think you need new contacts or new glasses, you can come to us first. We can do that test, and then if things seem like maybe your glasses or your contacts aren't working as well to give you clear vision, we'll help you get an appointment with an eye doctor to change your prescription. But we don't have an eye doctor on campus.
Thank you for answering that. You know what? I wonder, Lexi, it might be time to paste in the 2 links. We're going to send them, right? We're going to send them the PDF of the slideshow, as well as the former document that you so wonderfully made from your previous presentation about health insurance.
So here's the one from the previous presentation. And I'm gonna also find the PDF from this presentation.
Great. I might have saved it.
I just did it. I hope it works.
Looks like it's there. Yeah, looks like they have it downloaded. So if everyone can just take a moment and copy and paste it on your own computer, then you have it, or open it up and save it that way. So I think we're winding down, Alexi. I think that was the majority of questions. I'm going to actually stop the recording right now. Stop. Thank you so much for coming.